Ladies, do you feel that you were forced into having a hysterectomy, or are you glad you had one? Or are you contemplating the decision to have one? This truth may shock you. Hi everybody, Dr. Bryan here, retired gynecologist and founder of Health Without Risk. Today we're launching a 20-part series with Hysterectomy Truth number 1. Up to 90% of hysterectomies may be unnecessary. This isn't just a statistic, it's a wake-up call for women's health. And it ties directly to what I've seen in my practice and what the HERS Foundation has uncovered. So let's start with some numbers. The HERS Foundation, which has counseled over 5,000 women, found that 98% of them avoid hysterectomy after learning about alternatives. That suggests a staggering portion of the several 100,000 hysterectomies performed annually in the U.S. may not be needed. But here's the real shocker. The HERS Foundation estimates that gynecologists, hospitals, and drug companies make over $17 billion a year from these surgeries and removal of ovaries, leaning toward the hospital side. That's a multi-billion-dollar industry driving decisions, often leaving women with the message, it's your only option. I told you about Jen's story yesterday, and I've consulted with many women who were told that. They were terrified, feeling they had no choice. This is medical gaslighting. When your concerns are dismissed and you're pushed into life-altering surgery without knowing the full picture. But it doesn't have to be that way. There are alternatives for nearly every condition hysterectomy is offered for, and I want to share some of those with you today. Let's talk about fibroids, non-cancerous growths. 75% of women have them, so technically it's almost normal. Instead of a hysterectomy, a myomectomy can remove one or more fibroids, and gonadotropin-releasing hormone agonist medications or uterine artery embolization can shrink them. That's what Jen did. Endometriosis causing painful periods, cramps, infertility can be managed with laparoscopic removal of tissue or medications to reduce symptoms. Cervical dysplasia, procedures like cryotherapy or LEAP, can treat abnormal cells without removing the uterus. Heavy menstrual bleeding, hormone suppression, or endometrial ablation. I even did ablations in the office. HPV, regular monitoring or topical treatments often suffice. Endometrial hyperplasia, overgrowth of the lining of the uterus, hormone therapy may reverse it. Ovarian cysts, laparoscopic cystectomy works for most. Adhesions and scar tissue, laparoscopic removal. Menopausal symptoms, balanced and monitored hormone replacement therapy. Endometrial polyps, hysteroscopic removal is effective. Did those in the office as well. Uterine prolapse, a pessary, physical therapy for pelvic floor dysfunction, or bioelectric pelvic floor training devices are all options. Pelvic inflammatory disease, laparoscopy to clean up adhesions, and antibiotics. Adenomyosis, gonadotropin-releasing hormone agonists reduce symptoms. All of these options exist, yet too many women are never told about them. If you chose hysterectomy after understanding all of these alternatives, that's your right, and I respect that. But for those who felt forced, who were told it's your only option without a second thought, or you're contemplating hysterectomy, this series is for you. It's about reclaiming your voice, demanding informed consent, and challenging a system that profits from your uncertainty. Over the next 19 videos, we'll dive deeper into these truths. Why 90% of hysterectomies may be avoidable, how often they're necessary, how often they don't meet criteria, the health risks, what happens after hysterectomy, and how to advocate for yourself. Like and share this video with someone who needs to hear it. And in the comments, tell us, have you been pressured into a hysterectomy, or did it change your life for the better? Type my story below and join the conversation. Visit healthwithoutrisk.com for more resources on women's health and patient advocacy. Stay tuned for truth number 2 next time, where we'll explore why many hysterectomies don't meet the standards for for necessity. I'm Dr. Bryan, and this is Health Without Risk, where we explore options for better health you may not hear from mainstream medicine. Until next time, have a great day, and thanks for watching. Bye.